Good day. Now we're going to go back to our example from Tanzania to develop a fishbone diagram identifying the root causes of women not being tested for syphilis. We continue discussing the problem at the local level, where we look at the asymptomatic women in Tanzania, adverse effects from syphilis. And although women do attend ANC clinics, they are often not tested in Tanzania. For example, 1 in 4 stillbirths and 1 in 2 adverse pregnancies outcomes are due to syphilis in Tanzania. Less than half of pregnant women are screened. Only half of health facilities have testing capabilities, and even in facilities where necessary supplies are available, they still may not provide the screening. And in a lot of these situations, we find a majority of these problems happening in rural areas where there may not be the equipment or the skilled staff in order to do the testing and treatment of women. So here we have the beginning of our fishbone diagram. And at the head of our fishbone diagram, we have one of the main causes of women not being tested for syphilis, and that is the lack of screening of pregnant women. And then we group the root causes into 4 categories: facilities, patients, staff, and policy and administration. Now we'll dig a little bit more detail as far as what we mean on all these different categories. So as far as the facilities, there are a number of issues that could inhibit women from being screened for syphilis, such as the lack of supplies and testing kits, the lack of infrastructure, such as the ability to actually test women and do the diagnosis to see if they actually have syphilis. And there may be limited resources. And the limited resources, again, may be the laboratory or even the staff. And then we look at the patients. And so the patient may not return for treatment. Some patients do not even attend ANC. Or the husband may not even provide consent for the woman to get tested for syphilis. And on the staffing, the staff at the clinic may not be appropriately trained to do syphilis tests. They may not have the staff to even do the lab at these clinics. And that kind of gets us to the second point on the staffing, in that there are some staff who are not comfortable with doing the RPR test, which requires drawing blood, versus a rapid syphilis test, which doesn't require drawing a lot of blood. And then we have the policy and administration, where there could be supply chain issues. And when we talk about supply chain, we talk about not only the ability to deliver the supplies and testing kits to the facilities, but also going in the other direction, in which you have to deliver the specimens to the lab in order for them to get tested if the lab is not located in the facility. This maybe also be the lack of political will, and there may be other resource constraints. Like I said, not only are we talking about they may not have the lab capacity to do the test, but they may not have the resources there, such as trucks, to deliver the lab specimens to the actual lab to get tested. And again, that gets to the final point, which is quality control. You must make sure that the specimens are in a good enough condition in order to be tested once they do get to the lab. So all these are issues that could impact women getting tested for syphilis. That's the end of my explanation of looking at creating a fishbone diagram for our case study. So now you're going to start your activity in creating your fishbone diagram, looking at your root cause and identifying the target areas in which you're going to be using later in order to develop policies to attack the main cause as to why or as to how to solve your public health problem. Thank you.